Huh? I don't have it. Do you know that how many teeth do we have? 32? Teeth. Huh? So you have 16 and then you have 16. What do you call this teeth in front?
Incisor.
Incisor. What is incision? What is incision? What does that mean?
To insert.
To putol, to cut. So ganun yung incisors. Okay, these are incisors. How about the fang? What is the medical term for fang? K? K9. Yes, like the dog. Yeah. But the spelling is canine. Canine. Next, you have your premolars and then you have your molars. We also have 3 sets of your molar teeth. What is a denture? What is a denture, Alany? Yeah, but what is this?
It is a tooth.
It's a
Artificial tooth.
artificial tooth. It
Yes.
could be full or only one, or what is that?
No, it has to be full. Some
But is
people-
there only one?
No.
Yes.
Yeah, there's only one, there's 2, there's 3.
More than
Or there's also full. Yeah, there's also full. Like those old people don't have teeth anymore.
Yeah.
This entirely
They put below.
Is this expensive? How expensive?
Very.
very expensive.
That is why, since we know that these are expensive, guys, especially in America or in America or Europe, ang dentist service is very, very expensive. In the Philippines, it's sort of cheap, not really cheap, but it's also not that expensive, right? They're affordable dentists yung mga, yeah, but they use the wire ng sampayan. Nagtaka ka na lang kung bakit So anyway, the dentistry services are very, very expensive. This is also very expensive, but this is part of our role. Now, tell me, what are your instruments?
Okay. I have hand gloves. I have my kidney tray.
What is the other term for this? Kidney basin or
Kidney tray.
emesis
MS.
basin. What is emesis? Emesis, yung mga dura, mga sipon, mga
Mga eme.
mga MM. Okay, next.
This one, it's acting as my dental cap, okay? Because
Yes.
it just got a cover.
This is a takeaway for sinigang, but this is also for bulalo. But this is your denture cup. But there's a specific denture cup for the dentures, right?
Yeah.
So what do you put there? Is it a solution or is it just water?
It depends how the patient.
If you're rich, you put a solution. If you're poor, on the water.
Yes, it depends. No, it depends.
Okay, so there's a solution for the dentures that you can buy commercially. And if you don't have that, just cold water is enough. Okay?
Can you make your own seasoning?
Same thing
Like
with my
salted
hobby.
water.
This is
No, it's just water.
has to be soft because we are going to deal
Yes.
with
It has to be cold.
Yeah. And then we have our toothpaste.
Tuloy-tuloy pa
But
pala
in
siya.
most cases, we use the ones which are recommended for this tooth. Since we are in demonstration, it's fine. We are just using it.
Okay.
There's
Next.
a specific
And
toothpaste
then
that is a
it's already introduced because we also had one. It's fine. So what is the one? This one.
So you have your incisors, you have your canines, which is your fang or your vampire teeth, and then you have your premolar, and then you have your molar. You already have your full teeth. Ear wisdom tooth, you already have that.
already removed.
And then what do you call this one?
The
Gums.
gums.
The gums. If it's bleeding or inflamed or infected, what do you call that condition?
Gingivitis.
Gingivitis. If you have bad mouth, ano ba yun?
Halitosis.
Bad breath,
Halitosis.
halitosis.
This one is called the disposable oral swabs.
We also call this a tooth teeth. Tooth teeth. Oh, yung spelling is tooth teeth. Tooth teeth.
Tooth. Teeth.
Tooth tapos E-E-T-H-E.
E.
Parang tooth teeth. Okay? Next.
What is my solution? Give me the solution. That one. Yes. Sorry. This one is a mouthwash.
Not good for us.
And then we have this one. And the cleaning we put here. This. Yes.
Okay, now perform hand hygiene and don your gloves. What is donning?
We have this is the last we have paper tissue. This
Paper tissues or paper towels. What is that for?
This one, if like for example, if you are on the sink, you put it, then you make the water to come.
Got it.
Protect
Got it, got it. Okay. Sure. Now perform hand hygiene and don your gloves. What is the meaning of don? What is donning? Wear your gloves. Doffing, what is doff? Remove. Okay. So she will demonstrate specifically on the denture care. So now you've already identified the patient, you provided privacy to the patient, you're already in the bathroom doing the denture care, right? First, what will you put in the sink?
In the sink, I put the paper towels.
Why?
I first clean the place.
Okay.
Then I put the paper towels
Why?
to prevent the denture from breaking.
Why,
Some
guys?
bacteria
So to prevent the denture from
breaking.
breaking, pag mahulog to, di ba remember, this is expensive, right? What if it will shoot in the hole? What will you do? Nagahulog. Wala na, minus na lang sa kwan, salary. So make sure you are safe ba? Pag mahulog to, at least you still have cautions or may ano ka pa, protection. Okay, and then remove the denture from the cup and place it on the kidney tray. Okay, clean the denture thoroughly, focusing on the gum line. Where'd you get this one?
Oh, Amazon.
From where?
Amazon.
Where did you buy?
Amazon.
Why?
Because she's rich.
Because I can afford.
Not because I can afford.
Just because you can afford.
No, that's not the case. It's already there. Because I thought we didn't have that.
I think you have to put powder.
Oh, okay.
Okay, now you have to clean the dentures.
Yes. Okay.
No need na, it's okay.
Okay. Now we are going to clean, okay? Okay, this is my face. When we are cleaning, we have to focus on the gum line first, okay? This is how we are going to clean. We start from the lower one.
What is the degree in the, or the angle where you have to brush?
So I'm not sure, I don't lie.
Ikaw, Noor, how many degree or angle pag nagbabrush? Kayo, how do you brush, ha?
I brush
What degrees?
116 then up and down.
So usually nagbabrush tayo like this, right? This is 90 degrees. Like that, and then like this also. But that is actually wrong. According to the dentist, no, this is 180, this is also wrong. It should be 45 degrees like that. Okay? So if you're brushing your teeth, it should be slanting, not hindi siya ganito. It should be like that. And then here should be like that also. Okay? So hindi siya ganon. Wrong daw yung ganon-ganon. So dapat 45 degrees.
Understood yung 45 degrees, pero kasi sumpi ako, so 90.
Siguro ikaw 180.
Ano, yung humingikot na gano'n.
Yes, okay. And then you have to with the gum lines. Okay.
Better to use
We rinse it.
Rinse. Okay, rinse.
After rinsing, this is see, because this was here, right? Then supposed to be inside.
So you put it in the denture cup. Put the solution like water and then put it on the fridge overnight. But since we are in the patient's room, some of the patient's room don't have a fridge. So you just have to store it in the denture cup with cold water.
Yes.
And then put solution whatever, if there's any solution.
Yes.
And then you put it on the patient's bedside.
Yes.
Why not in the patient's cupboard?
We put it next to the patient,
Why not away from the patient?
away from the patient,
Why
because
not?
sometimes some patients are not able to move and get it by themselves.
Yeah.
Question. How long can the patient wear the dentures?
So it depends on the patient.
Can they wear it like 24?
Like sometimes you can remove it if you're cleaning. There are some people, of course, we allow the fresh air to enter. You understand?
You want the fresh air to enter the
yeah,
mouth.
you cannot keep wearing it.
Well,
To me.
it depends. No, some of them they don't sleep on it during bedtime, so they remove it during bedtime, and then during morning time or waking hours, then they have to wear the dentures. I think the good question is how often should you clean the dentures?
Yeah.
How often should you clean the dentures?
Then you clean after meal. Morning, after yes, in the morning when you wake up. Yes.
So in the morning, upon waking up, you have to brush your teeth, do your oral care, and then also wash the denture, and then
So every meal, it's not like twice a
No,
day,
it's
twice a
not
day.
like you can't eat chocolate, then you expect someone to come and do it.
so hindi daw siya, every time na kumain ka kuno, tapos ibabrush ka ng teeth, pag magkain ka ng chocolate, ibabrush mo na naman ulit. Hindi daw ganun, right?
Yes.
Yes, I understand that because that is not a meal. When you say meal, it's a full. Yeah.
So, when is the best time? I think there is no hard rule to that.
Yes.
Before, usually after eating, right?
Yes.
As long as what's important is that it should be well fitted. If there's any cracks or any mga dents dun sa denture, then you have to report that. Other than that, it should be okay.
Yes.
Alright? Anything you wanna add?
Not really.
No? Okay, thank you.
Done what?